Hello there again. This is Sugar Beastie. You may know me from other videos that, again, Fat Preacher Man has been taping me on, whether it's been a phone or just comments about other certain things or commentaries. Before I had did a quick health segment on IBS, but today I wanted to go over one that is personal to me, and that is influenza. Health issues concerning influenza or the flu. The family actually has just or is in the process of finishing the flu. One of the things that you should know is doctors are quick to tell you, get immunized, get vaccinated, do what you can to make sure that you're protected from the flu, and this is true. However, be very cautious. See your doctor first, and I always say this because not everybody should have the flu shot. There are certain health issues that your doctor will go over to see if you qualify or you should have the flu shot. Of course, one being that if you are carrying child, if you are pregnant. One of the things they do say are people that should have the flu shot are young children or very small children, and the elderly, and of course those they say that suffer from breathing ailments, COPD or asthma. Now, one of the things I learned that was interesting before I go in further dealing with the flu shot is that you can have the flu shot and still get the flu. Some people go, well, how is that possible? Because the flu shot that they give out every year is just going to vaccinate you from the biggest strand or the most popular strand or widespread strand of that particular flu for that particular season. So if you happen to get another strand or if it's mutated, then it's not going to protect you against what you already have been vaccinated against. We're not talking about I was vaccinated against the measles, so I won't get it. That's different. There are different strands of the flu. So I didn't know this. So our family came down with the flu. It was a good thing that we came down with it together. So whatever type or strain that it is, we're going to be immune to it. It is very important for people to understand when getting immune. Of course, be careful who you're going to be around. If you have any questions or concerns, go to your doctor. If you work around the elderly, if you work around small children, pregnant mothers, or you're around that particular group, I would definitely consider talking to your doctor about getting vaccinated because you don't want to make them sick. I know from the past of having 3 children, being pregnant, when you get a cold, just a basic cold, there's not really much you can take. So imagine when you have something that's more serious like the flu and the things that you can contract from having the flu. It can be very deadly to a fetus. It can be very hazardous to the health of a mother, a pregnant mother. So let's go on. I wanted to talk about, like I said, the flu. You know, and I talked about asthmatics, and one of the things, like I said, I wanted to talk about because this was very close to my heart. It is very, very debilitating. It started out with us seeming like it was just a regular cold, which was no big deal. We've had bad colds in the past. I did have the flu, however, years ago when I was in my early 20s. Don't want to give away my age, but I had it years ago when I was in my 20s, and it was horrible. So this time when they said that it was a possibility we had it, I figured no, because I didn't feel the same way. But let me share with you some of the signs and symptoms that you can have with the flu. Fatigue and tiredness, not just your regular, oh, I'm tired like I worked. This is a little bit exasperating. It's a little bit more tiredness and more fatigue. Maybe like you have been working all day but really been doing nothing. Maybe you woke up and it feels like, wow, I just feel like, I don't know, maybe you've been drinking all night or whatever. But you feel this unusual fatigue or tiredness. It may even build up or lead to it. You may also come down with a sudden cough. You may notice that your eyes become increasingly sensitive to the light. You may become nauseated. May have a few stomach cramps, maybe even possibly vomiting. You may notice that you may feel chilly or extra cold, so you might want to put extra blankets on you. However, you have a fever. Maybe your fever usually would run through maybe 101 to maybe up to 104. This is unfortunately, part of the flu, what is called chills. I found this out because I felt so cold, and I would put extra covers on me, even a heating pack, which actually made the fever, of course, even higher. And what does bacteria need to grow in, people? It needs a moist environment or a hot environment to grow in. And the more heated your body is, the more that bacteria wants to grow and spread and make you even more sick. Again, I said fatigue, tiredness, fever, the chills, cough, nausea, possible vomiting, headache. The headaches with influenza or the flu can be very, very painful. I talked about light sensitivity. Of course, with just even a regular cold, sometimes you may have nasal congestion or severe nasal congestion. One of the things I've noticed with the flu as well is you'll have this possibility of loss of appetite. You really don't feel like eating. It might even change your taste buds. Things that you normally would like to eat, you don't really eat anymore. And this has become a problem, possibly because of maybe the fever that you had, becoming dehydrated, which can lead, unfortunately, to things like irregular or fast heartbeat, which can be very dangerous. So it's good to make sure you want to keep yourself hydrated with fluids while having the flu. You may even have trouble sleeping. Usually with the fever, you want to sleep all the time, but you may have fits of wanting to sleep all the time versus you can't sleep, not because you're not tired, but because of severe nasal congestion and so on and so forth. Also, in addition to possible loss of appetite, you may notice also that you may start to have a cough. The cough may be a hacking cough. You may start to bring up mucus that is discolored, not your regular light yellow or white mucus, but the mucus may turn to green, maybe even a dark brown. This may be a sign of infection. Maybe pneumonia could be setting in. Pneumonia sometimes is common to people who can have the flu. If you see this, if you notice this, if you didn't want to go to the doctor, this is the time to say, I need to go to the doctor, because you just can't cure pneumonia with medications that are over the counter. You might need antibiotics, or you need to be hospitalized depending on how bad the pneumonia is. As I said before, you're probably going to end up having a headache, probably due to sinus congestion or the light sensitivity. It depends. Now, one of the things that I noticed too, unfortunately, the recovery time with the flu can be anywhere from 1 or 1.5 weeks to up to 3 weeks. And I was like, wow, because it can do that much damage to the body. And it can be up to 3 weeks because of any other ailments that you might have already been suffering from. Has your immune system already been compromised? Maybe you've already gotten over a cold. Maybe you're taking medications that have compromised your immune system, or so on or so forth. Again, like I said before, because of the fever, because of the loss of appetite, you may not want to feel like eating or drinking anything, but it is very, very important for you to drink as much as possible. Not alcohol, not sodas, but to drink as much water, as much Gatorade, things that have electrolytes and a little bit of sugar. We, as a family with children, like to keep popsicles on hand, because it's hard sometimes to make yourself drink lots of water. But if you can have popsicles, maybe you can freeze some orange juice and make like popsicles into, orange juice into popsicles or something like that, to make sure you're constantly getting the vitamins that you need, and you're constantly getting the vitamin C, replacing the electrolytes, and you're constantly getting fluids into the body. And when you're biting a popsicle, you're taking more fluid in than you actually realize versus, oh, I just sipped a few sips of water or half a cup of juice. Another thing that you want to refrain from in over-the-counter medicines is you want to try to avoid as much as possible anything containing aspirin. Now, this may be a little bit hard to do for those who are heart patients, because some heart patients have to take a regimen of baby aspirin, 81 milligram aspirin, twice a day or once a day. It's very important that you talk to your cardiologist, that you talk to your doctor once you've been diagnosed with the flu, to ask them, what do I do about this medicine? The reason why they tell you not to take aspirin when you have the flu is because it can damage the liver. It can cause also an ailment in younger children called Rye syndrome. So you want to be very careful when it comes to over-the-counter medication, especially with any medication you're already taking, when it is pertaining to the flu. Usually when you go to a hospital or to a doctor, they now will have a test to tell you whether you are positive for the flu. Word to the wise and to be warned, the test is uncomfortable. They took a Q-tip or a cotton swab, and I'm not talking about your basic Q-tip. I'm talking about something that is about, I don't know, about 2.5 times longer than this. And the Q-tip reminds me of an old trick that my husband used to do with the kids, making it seem like the Q-tip disappeared, except the Q-tip disappeared for real. They take a long swab and they go to the very back of your nose and they swabbed it. Very, very discomforting, but it's necessary. And then they test it to see if the mucus on it contains the bacteria of the particular influenza or flu virus. That's how they'll be able to tell. And then they'll be able to give you medications accordingly. Sometimes if you have no pneumonia present or anything like that, and it just seems like a basic flu, they'll just maybe give you something maybe for coughing or something like that to help kind of relieve the symptoms a little bit. But basically, a lot of fluid and a lot of rest is what they're going to tell you to do. Unless, again, if you have an infection or something a little bit more serious that the flu has caused. Again, when you are sleeping or going to bed with the flu, it is very important, as I have found out, when having a fever, you want to make sure that you don't keep yourself covered a lot, because you're going to be trapping the heat, making your body even hotter. One of the things that I had learned, and my husband reminds me of, keep your feet out of the cover, because when your lower extremity is exposed, heat is allowed to escape a lot faster. So if you want to pull back the comforter and just have a regular sheet over you, maybe just a regular sweater, and sleep on top of the covers, that's fine. You don't want to be freezing, but you want to keep your body cool. Again, it might help to have a bottle of water on the side of the bed to constantly be drinking. Get up, walk around a little bit. Take frequent showers. It might help also to have a cool cloth to wipe over you. Again, you don't want to cause your body to go in shock and drop yourself in ice, but you want to make sure that you are staying at a temperature that is not going to overheat your body. There comes in medications such as ibuprofen or Motrin or Tylenol that the doctor will tell you or prescribe for you. They even might prescribe a particular cough medicine or something that may contain this element in it. Tylenol is good, especially for those who are pregnant or can't take Advil or Motrin. People who have sensitivity to their stomach, who aren't allowed to take a lot of Motrin, Tylenol may be the best option. Unfortunately, Tylenol works, you just have to take it more frequently. But things like Motrin and Advil, you take a little bit and it works a little longer. Tylenol usually works 3 to 4 hours. Motrin will usually work anywhere from 4 to 6 hours, depending on how much you take, up to 8. But with Motrin and ibuprofen, you have to be very careful because they can irritate the stomach. You usually want to have something on your stomach first before you take it, so you don't have a problem with your stomach on top of everything that you already have. Again, these are just a few tips that I wanted to share with you. I just wrote down some notes to remind myself of you. Again, any over-the-counter medicine that you take, consult your doctor or your pharmacist first, because you want to make sure it doesn't interact with any medicines you're already taking. And again, make sure they're non-aspirin products. And again, consult with your doctor and your pharmacist to make sure they're not going to interfere with anything or any medicines you already are taking. Even anything such as grapefruit juice, you might want to talk to the pharmacist or doctor before you take the medicines, because grapefruit juice can break down how the medicine works in the body or how it is eliminated. At any time during the process of having the flu, if your fever does not go down, if you have any more issues, if you're been diagnosed with pneumonia, or you're noticing more coughing, more mucus, or you're just not getting better, or your mucus is changing color, or whatever of the sort, you're just not feeling better even after seeing the doctor or after being diagnosed or going to the hospital, go back to the hospital or consult your physician again, because there could be something more going on at hand. It's very important not to just be lackadaisy about it, or just go, no big deal, you don't want to bother anybody about it, because the flu has claimed a lot of lives every year. Again, this was just some tips to let you know and to discuss with you about the flu. This is just a short breakdown of it. If you have anything that you want to share, even maybe your experience with the flu this season or last season, please feel free to share, so that we can let others know, that you can let us know if there's anything that I missed or anything that you experienced that was frightening or is unusual. Let us know so we can share that and we can post that and let others know as well. But overall, for the flu, folks, the best thing you can do outside of going to the doctor is to get a lot of rest and a lot of fluids. So again, this has been Sugar Beastie with some health tips, just the facts, just to let you know on some health issues. Again, hit us up, let us know, email us so we can go ahead and put up and display and talk about the issues that you want to know about. Jesus bless you and good health. I'll talk to you soon.